A lot has been happening in the field of neurological health and brain disorders, especially in 2 years, and this was indeed the topic of my presentation. So what we've seen lately is that the WHO finally is putting a comprehensive framework for the neurological disorders. So until recently, they were quite fragmented. So we had stroke that was still seen as a cardiovascular disease, for instance. Now it has been reclassified as a central nervous system or a neurological disorder. We had brain tumors that weren't seen, for instance, as a neurological disorder or were not classified, some infectious diseases. This is now being all put together, and we started really appreciating what does it mean to have neurology as a distinctive and comprehensive field. So along these lines, WHO is now launching what they call a global action plan or intersectoral global action plan on epilepsy and other neurological disorders. This is a comprehensive set of actions and targets that is going to be implemented over the time of 10 years and is giving us a fantastic global framework, which then will be kind of cascaded down, spilling over to the national and regional level. The way the Global Action Plan is structured is that it has a set of targets and indicators. So you have, for instance, a target that 75% of countries globally are supposed to come up with some kind of a national set of or national action plans, strategies on neurology. So this is something that the countries will be held accountable to. Similarly, we'll have a target that is looking at conducting national awareness and advocacy campaigns and other targets. And for the targets I just mentioned, will be really important to keep in mind. We know this from other disease areas, for instance, from national cancer plans, that it will be critical to have patient advocacy groups involved at the national level, both in formulation, adoption and implementation of national neurological strategies or maybe brain health strategies, including mental health, and also in the targets covering awareness campaigns. So we as EFNA, as the European Federation of Neurological Associations, really see an opportunity here to have this effect happening at the national level by bringing all these actors together. So the OneNeurology is a fairly new campaign and partnership and initiative. It was set up a little more than a year ago, and it was addressing a global need to have a group, an organization or a group of people that speak in one voice on behalf of neurological population. And the OneNeurology consists of different global and regional organizations that either cover certain disease areas such as Alzheimer or stroke, or for instance some specialties like sleep or neuro rehabilitation. So we all come together, and really the objective is to make neurology a global public health priority. And the objective also is, in a way, to become a one-stop shop for global and national policymakers. And also, of course, one of the activities of OneNeurology now will be to align with the Global Action Plan. We've been really critical in the lead-up to its adoption. We took part in public consultations. We've been providing a lot of feedback that was then to a large extent integrated in the latest version. And now, of course, we will be playing an important role in the next 10 years in the implementation of the Global Action Plan.